So good morning everybody, my name's Suzi Armitage. I have the rather delightful title of Designated Doctor for Child Death for Leicestershire and Rutland. I also work as a community paediatrician, and I'm going to do a bit of a background to why we felt we needed something to help support practitioners when they're talking to families, and then Jan is going to go through the new tool and what that looks like. Get the right slides, there we go. So I work as part of the Child Death Overview panel, and we follow a set of guidance whenever a child dies, and this is a really key quote that sort of sets a bit of context for what we're talking about, that whenever an infant dies, it's a tragedy, first and foremost for that infant and their family, but also for those who knew the family and the infant, including those professionals who may have worked with them, and for society as a whole. So this is really about sudden infant deaths and safer sleeping, and I should say at this point we recognise that this topic can be really difficult to talk about. We all have different life experiences coming into this room, so if you need to touch base with someone, get a moment. If you find this difficult, whatever, please do take a moment to do that. What we're talking about is reducing the risk. So we cannot prevent every death, but what we want to do is think about how can we reduce the risk to make things safer. So what we do know is that across England and Wales in 2020, 150 babies died, and in spite of very extensive and thorough investigation, the cause of their death remained unexplained. Also, what we know from research is that safer sleep practices can reduce the risk of sudden infant death syndrome and reduce the risk of accidental suffocation of infants during sleep. What we have seen over time is that the number of babies dying suddenly and unexpectedly has come down markedly, particularly with the Back to Sleep campaign in the 1990s, but that fall down has tailed off and plateaued. And we see particularly in babies from more deprived backgrounds, they remain at higher risk than babies from more affluent backgrounds, and a considerable amount of work and research has been done to try and understand some of the vulnerability factors around this. So who is at risk? What do we know from the evidence? And the evidence, if you're interested, is all on the Lullaby Trust website. It's a fantastic resource and really recommend it. So we know that if you're in an unsafe sleeping position, you're at higher risk. If your parents are smokers, and when we're talking about unsafe sleeping environments, we're thinking about unsafe co-sleeping, overwrapping, being on soft sleep surfaces, parental alcohol and drug use, poor antenatal attendance or late booking, and being born preterm, so that's before 37 weeks, or if you're low birth weight. And we know things that make sleep safer. So sharing a room with your parent or carer for the first 6 months of life, breastfeeding, use of a dummy, immunisations. The National Child Mortality Database it's a fantastic resource, and every child who dies in England has their death is reviewed to identify factors that might have contributed, and all that information goes to the National Child Mortality Database. So they have a big national data set that they can use for learning. And they have very recently, in September, published a paper looking specifically at babies aged 3 to 12 months who died suddenly and no cause was found, to look to see what are some of the risk factors that are emerging from that national data set. And it is, fortunately, a small number. Nevertheless, looking at those cases across all of England, a very high percentage, nearly 80%, were not following safer sleep advice and guidance when they died. And they looked at factors that we think increase the risk. And looking at the data, if a baby was named to social care, it was felt that they were at 14 times higher risk of dying suddenly and unexpectedly, 14 times higher if there was an experience of domestic abuse, 12 times higher if they were born extremely premature or very low birth weight, 9 times higher with an underlying health condition, 5 times higher if there was poor maternal mental health or if it was particularly young mother, 4 times higher if mother used drugs during pregnancy, and 3 times higher if smoking in pregnancy. So we recognise with small numbers these risks, and it's a relative risk. The relative risk is already very small, but it increases with these factors. It gives a a pattern really of vulnerability for these particular babies. And thinking about it in terms of the assessment triangle, those factors relating to the child, to parenting, to the family environment, map out in the way shown on the slide. And we very much use this to inform the tool we've put together for practitioners to work with. In terms of that key safer sleep messaging, we know that the safest place to sleep for a baby is on their back with their feet to the foot in a cot or Moses basket in the same room as their parent or carer for the first 6 months. However, what we also know is that babies are complex, family life is complex, and decisions that families make, parents make, carers make, that decision making is also complex. Babies fall asleep all over the place in all kinds of different places. So it's thinking about how do we make that kind of key piece of guidance relevant to families. So the Lullaby Trust have come up with an ABC of safer sleep, which is really helpful because it helps to apply it to all kinds of different situations, not just a Moses basket in the house. That a baby should always sleep on their back in a clear cot or sleep space. And it's kind of recognising, I guess, the context that a lot of families are living in these days with social media and Instagram, and it all looks very pretty and very cute and very beautiful, and there's lots and lots of images around, particularly on social media, of what are objectively unsafe sleep environments. So it's supporting families to try and manage the messaging we're giving them to make sort of good decisions, recognising all this going on as well. In terms of the evidence-based guidance, health professionals in the room will know we've got nice guidance that we follow for postnatal care, which says that we should be discussing safer practices for bed sharing, and strongly advising parents not to share a bed with their baby if their baby was low birth weight, has had alcohol, either parent smokes, parent has taken any medicine that causes drowsiness, or either parent has used recreational drugs. So these are the messages that the health professionals, the midwives, the health visitors will be giving to families. It's also worth pointing out that actually there is a legal aspect to this, that there is a criminal offence of overlay, and the police can also potentially bring criminal charges of neglect. And there are situations where that has happened. So again, it's just making sort of everyone aware. We don't want to sort of use this to scare families into anything in terms of following advice, but it's just being aware that the police are obliged to look into the circumstances of death. And if it's been found that these are met, then potentially parents can be prosecuted. There was a big report done by the National Safeguarding Panel called the Out of Routine Review, and this was a review of sudden unexplained death in infancy in families where children are considered at risk of significant harm, and it was published in 2020. And what they found was that many of the risk factors, as we've seen for Suzi, overlap with those for child abuse and neglect. And they've sort of put this model together looking at children who have predisposing risks or predisposing vulnerabilities, and then alongside that come these situational risks and being out of routine or critical incidents. And these seem to be a sort of a model of what happens in some of these cases for these really vulnerable infants. And that families were typically living in the context of what are well-recognised background risks. Disruption to the normal routine in that means they're unable to engage effectively with the safer sleeping advice. And they propose this model of prevention and protection. So we're wanting to inform families so they're aware of the risks, having a very conversation-based approach, recognising that decision-making is complex, linking the advice to an understanding of why we say that, why we say don't overwrap your baby, because we know babies can get too warm, they can't regulate their temperature, rather than just giving a list of instructions, and empowering families with knowledge so that they can assess their own risks and develop their own plan for safety at every sleep. And then looking at the protection side of that, so actually having an early recognition of and response to those factors, which mean infants and families are vulnerable. And the challenge is we know that period of vulnerability is very early on in that infant's life, and services may just be starting to come alongside families at that point. We recognise that safer sleeping needs to be part of a broader assessment of risk, and safer sleep is actually included in the LLR neglect toolkit, and that safer sleeping needs to be considered as part of safety planning for families with young infants. So, this is our tagline, that safer sleeping is everyone's business, that it's not just for the health visitor, it's not just for the midwife. and that for every baby we want to be having curious conversations. So in whatever context we're coming across families with young babies, whether that's in housing, whether that's in a DV refuge, whether it's through early help, in whatever context, having curious conversations, making sure that we're talking about safer sleep for every sleep, helping families to think through what would they do if they suddenly had to leave the home, if they're having friends over to stay, how would they manage that change in situation. Consistency of messaging is absolutely key, and thinking family, because it's not just the mum that cares for the baby, but thinking through that wider family, and supporting parents with managing the messaging that comes from grandparents when the grandparent says, well, okay, slept with all of you and you were all fine. How do we help them to manage that situation? And having all this thoroughly embedded in support for broader family risks and vulnerabilities, so thinking about things like breastfeeding promotion and support, smoking cessation for household members, support with housing. You know, if there's not physically space in the room for a cot, that compromises potentially that baby's safe sleep space. Around support for families where we know there are issues around alcohol use, substance misuse, parental mental health services and domestic abuse support. So I'm now going to hand over to Jan, who is going to talk through our risk assessment tool.
Morning everyone, I'm Jan Harrison. I'm one of the designated safeguarding nurses. I work with the Integrated Care Board safeguarding team, and as Suzi has said, we've had a number of our rapid reviews where there has been some form of overlay with the baby, not absolutely attributed to the child's death, wasn't exactly attributed to the overlay. However, it is all around safer sleeping practices. So what we did was we got together one of the famous task and finish groups and a group of really enthusiastic individuals, some of whom are in this room now, so thanks for coming along. And we have borrowed, with permission, some information that Nottingham were using around safe sleep, and we've adapted it to our own circumstances locally. As Suzi has said, our strapline is really that safer sleeping is everybody's business. I think it's around reducing the risk of suffocation, not just cot death, but it's that suffocation that would cause the death of the baby. And what we have done is we have reached out to all of our borough councils and many agencies to ask for agency representatives who are willing to take a set of slides, which I'm going to show you now, back into their team meetings to get this message out to every member of staff, really, anybody who comes into contact with families. And we're talking about babies under the age of 1. Now, our midwives and health visitors do a brilliant job. They have a very programmed approach to ensuring that families antenatally and postnatally are aware of how they need to be ensuring safe sleep spaces for their babies. But obviously, where things are going well in those families, many of those families will not have continued involvement by those services, but your service just might. So we're not asking everybody to become experts in the field of this, but we've hopefully produced something that you will find valuable in sharing with families, and bear this in mind when you walk into a home and the baby's in the pushchair in front of a radiator still with a rain cover over it and that kind of thing, just so that you can start to have a good conversation rather than a dictatorial a conversation around what they shouldn't be doing. So I'm sure that you're all familiar with accessing the LSCB website, and you will see here that this is where our risk assessment tools are. So we've divided it into 3 sections, and I'll show you each section on the presentation in a little while. So we've got one, the first section here is the whole of the risk assessment tool, and then we've divided it up. This section here you can print off to share with families and put it in your pocket for when you go out to see families, or access it easily from your, I don't know, electronic devices that you might use when you're with families. But then also, what we've also devised is a safe sleep plan. Now this you can leave with the family and I'll go through that because it's asking the family several questions, such as, when I'm out of routine, how am I going to keep my baby safe when they're sleeping? So this is for parents themselves to think about their own individual circumstances and the resources that they have to keep their babies safe. Okay, so that's the link, but you'll find it on the LSCB website anyway. And I believe, are these slides going out to everybody afterwards, so you'll be able to have those. Okay, so this is really all around the Safe Sleep Assessment tool. It's talking on here around the safe sleep messages that Suzi has already put onto the screen. So things for parents to avoid. So this is for your information, basically. This is so that you can have an informed discussion around the safe sleep messages. Obviously, there's quite a bit of information on here, and you wouldn't be sharing all of the information with families like that. Safe sleep and the law. Everything that Suzi has said about safe sleep and the law is on here. So all the information that Suzi has just given is in this complete document for you to have a read through yourselves. This is the safe sleep risk assessment, as Suzi has said, and we've written it based on the assessment framework triangle. And those, again, what Suzi was saying earlier on about around the child, the parenting capacity and the family and the environment, and reiterating that, if a baby is born prematurely, if they're under 2.5 kilograms in weight, they will have an increased susceptibility. And obviously this, where we know that that's happening in families, we'll be reinforcing those messages. So these are really just reiterating the slides that Suzi has provided, but the other thing that we've provided is this for the carer. This is the really important section, really. This is your guidance for talking to families. So it's just a general conversation that we're hoping you'll be able to have with families. So you may want to ask the questions around, well, who else is looking after your baby? Do they understand about safe sleep? Can you explain to them about safe sleep before they look after them? And, how to keep your baby safe. Thinking about, where did your baby sleep last night? Where did they wake up this morning? With those two different situations, is that where they normally sleep? Just asking questions like, if you went to visit a friend, or if you had to leave the house in emergency, and we do know obviously that there are people that are leaving abusive relationships in an emergency and having to go and stay with friends, relatives, or even in a refuge. Is there somewhere there that you can ensure that you're keeping your baby safe when they're sleeping in a safe sleep position? So it's broader than just saying, making sure that you've got your baby on their backs in a safe, clear cot. It's thinking around those wider environmental issues. And really importantly, if one of you is going out for a drink, or if you're going out, you're going to be taking alcohol, or let's face it, any other substance, how can you plan ahead to ensure that your baby is going to be able to sleep in a safe space? So these were just some ideas for you around developing those better conversations. So this is for sharing with the parents anyway. So this is what you can leave with the parents for them to go through themselves in terms of the sort of things that they can think about and do to keep their babies safe. And then also the information around here around sharing a safe sleep space. So basically, I should only ever let a baby share my sleep space if they were born at full term, weighing more than 5 pounds or 2.5 kilograms. And I should only ever let my baby share my space if we are sober, we don't smoke and haven't smoked during the pregnancy, we're not taking any medication that could cause drowsiness, and we're not under the influence of recreational drugs. So if they are sharing any kind of space, that parents double check all of those items, because we do know that it's like Suzi says, we can't prevent cot death, but we can reduce the incidence of this in having these better conversations. So what we've done is we've put within the slides some areas where you can find out more information, particularly the Lullaby Trust, and also the information again to the neglect procedures on the LLR website, because obviously if we knew as professionals that parents were completely ignoring this advice and that there was a risk, and the baby had been into hospital several times, been to ED, been to see the GP, and the parents were completely ignoring the advice, and we had evidence of that, then it could form part of the neglect assessment that practitioners were undertaking. Thank you very much for bearing with me. And I'm hoping that you've got a single point, a point of contact for us, because what we're doing is we're actually holding bi-monthly meetings. We've got some bi-monthly meetings booked in, so that we're working as a team of individuals to go out to our own staff, frontline staff, to share these messages. And just so if people have been asked quite awkward questions or are in difficult circumstances with families over this, we might be able to unpick that. So it's a little bit of supervision, but more importantly, we're trying to gather some practitioners out there from all areas of our workforces to become our sort of champions for safe sleep and prevention of suffocation and infant death, cot death. So I don't know, Liz, if anybody's really keen to do that that's in the room today, could they leave their name with you to pass on to Suzi and I, and then we'll share the meeting dates with them. You don't have to come to every meeting. It's just so that we keep the messages buoyant, and this isn't just something that's in the procedures but nobody else really thinks about. So thanks for bearing with me. Thank you.